All right, Mr. Leon. So now we're gonna move to do your musculoskeletal check right now, your assessment, and we're going to begin with the neck. Okay. So now I'm just gonna inspect your neck. I'm gonna look at your neck. I'm looking for any nodules or any abnormalities. Everything looks good. So now I need you to do a quick test for me. I need you to look up. I need you to look all the way down. I need you to move your neck side to side. And then I need you to kind of like try to one side and the other side. All right, so the range of motion of the neck seems to be good. There's no abnormalities or findings in his neck or anything, so the neck looks good. Now we're gonna move forward and we're going to, I'm going to put some pressure on your head. So I want you to try to move your head to your left, to your right. Okay, now try to push it forward and try to push it backwards. All right, so range of motion and strength of the neck muscles seem to be pretty good. So now we're going to go ahead. All right, so now we're going to go ahead and check for his upper extremities. So I'm looking at the symmetry. Everything looks normal within range, how it's supposed to be. Now we're going to ask the patient to put his hands to the side, upwards. Okay, that's good. Now push all the way to the front to me. Okay. Now I need you to go, put your arms in this position. I need you to go against you as strong as you can, towards me, as strong as you can. All right, so that's good. Strength and range of motion of the arms is good. Now I need you to put your hands forward, and I need you to just your wrist up and down. Okay, side to side. All right, range of motion of the wrist is also good. Now if you could just show me your fingers, your phalanges, and put them down, upward, and try to put them on top of each other. All right, so range of motion and of the phalanges is good. Now, kind of the same thing with your wrist. I want you to squeeze me as tight as you can. These two fingers as tight as you can. All right, strength of the hands is good as well. So now we're going to check for the lower extremities, and we're going to check for the same thing, for strength, range of motion, and we're going to inspect. I'm gonna have you to put your legs down for me. So there's no deformities or no masses or anything in his legs, so that's good. I'm gonna ask you to try to put this knee as high as you can. Okay, that's good. Now I'm gonna need you to do the same with the other one. That's good. Can you put this leg over this leg for me? Good. Now do the opposite thing. Okay. Now with your right leg, I want you to caress your left shin. Good. Now the opposite. Good. 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 Now I want you to put your legs up, your knees up. All right. And I want you to push towards you as strong as you can. All right. Now away from you. Away. Good. Good. So now I'm going to do the same with your feet. I want you to try to push against me, as strong as you can, away from me. Good. Now you're going to do the same thing with your bottom, the bottom of your leg. Now put your legs up, down. Good. So range of motion and strength of his lower extremities are also good. And also I did not find any abnormalities with his lower legs. Mr. Leon. So now we're going to move forward to do check your gastrointestinal portion of your assessment. Okay, so that requires that I check for your vowel sounds and also that I palpate. So it may be uncomfortable, okay? So the first thing that I'm going to do, I'm going to inspect the abdomen, and I'm looking for any abnormalities. And abdomen seems to be pretty normal, within normal limits. Now I'm going to go ahead and listen for vowel sounds, and I'm going to do that before palpating because I don't want to disturb the vowel sounds. So I'm going to listen each quadrant for 1 minute. And for the purpose of the video, I am not going to listen for 1 minute. All right, and vowel sounds are normal. I'm going to go ahead and do a quick palpating of your vowels. Please let me know if you feel any tenderness at any moment, okay? Any tenderness? No? And I'm palpating for any masses or any abnormalities that I may find. His stomach feels normal. There's no distension or hardness. All right, everything looks good. Thank you for participating in this assessment with me, and we're done. So we'll see you next time.